guidance and advice from the Foreign and Commonwealth Office. Its website suggesting that Britain should avoid all but essential travel to Mexico. It also says that British nationals resident in or visiting Mexico may wish to consider they should remain in Mexico at this time. It links to the World Health Organization website, further explaining about swine flu. In the House of Commons yesterday, the UK's Health Secretary detailed the UK preparations against the virus.
The UK has been preparing for a flu pandemic for the last 5 years. We have established a stockpile of enough antivirals to treat more than 33 million people, that is to say, half of the United Kingdom population. All NHS organisations have pandemic flu plans in place, and the Department of Health is now working closely with the NHS to ensure that these plans can be put into action so that antivirals can be made available to the public very rapidly should we reach that stage. Over the weekend, the government has been putting in place precautionary measures to implement the plans we have been developing in the case of more widespread infections in the UK. I've spoken to ministerial colleagues and my opposition shadows this morning, and I'll be convening a meeting of the Civil Contingencies Committee immediately following this statement. We have enhanced our port health checks so that passengers arriving in the UK with symptoms of illness are identified and assessed. Information is being made available to passengers arriving at ports, and we have provided urgent advice to doctors. Should the virus start spreading widely in the UK, we propose to use our antiviral stockpile for treatment of symptomatic patients. We already have advance agreements in place with manufacturers should a vaccine be developed, although it's important to note that it will be some time before scientists can develop a vaccine, as the virus is not yet sufficiently understood.
It was important to put this into perspective, he said.
Speaker, there are 3 key messages that I'd like to stress at this stage. First, it's important to emphasise that in all cases outside Mexico, the symptoms of this illness are mild and all patients have made a full recovery. Second, we can all take simple measures to prevent infection, in particular covering the nose and mouth when coughing or sneezing and washing hands regularly. Anyone who develops flu-like symptoms should go home and contact their GP. Third, anyone who has recently travelled to the affected areas and is experiencing influenza-like illness should stay at home to limit contact with others and seek medical advice by phone from a local health professional or NHS Direct.
Meanwhile, laboratory work continues in Britain to develop more protection against viruses. A pandemic is not considered at all inevitable, but nonetheless, precaution and preparation remain the key.